The use of magnetic resonance imaging in the diagnosis and prevention of equine laminitis. This is the basic diagram of a horse's hoof. The most important features in regards to laminitis are the hoof wall, lamina, coffin bone, coronary band, and sole. Laminitis, by its most basic definition, is an equine disease that causes inflammation of the lamina within the hoof of the horse. This is a soft tissue structure attached to the coffin bone of the foot. The lamina forms an attachment to the hoof wall as well, so that the two structures are connected. There are two ways in which the coffin bone can separate from the lamina. The first is rotationally, in which the coffin bone detaches and the tip moves towards the ground at an angle. The circumflex artery and vein are constricted by the coffin bone pulling away. Since they can no longer allow blood to provide nutrients within the region, inflammation will occur within the hoof wall because it is attempting to make up for the loss of normal blood flow. When the inflammation persists, the lamellar attachments will continue to weaken and pull away from the hoof wall altogether. The front of the hoof will become extremely painful in this region, so the horse will stand on the back of its hooves. The next issue comes from inflammation in the lamina around the coronary band, hoof wall, and sole. Any weight put on this region will tear the coffin bone away from the lamina so that it rests in the sole. This is extremely uncomfortable, so that the horse will attempt to stand as if they are lifting their heels up beneath them. What is the difference between laminitis and founder?
Oftentimes, laminitis and founder are used interchangeably, two terms. Laminitis refers to the inflammation that occurs within the lamina. When the bone actually changes position in the foot, it's known as founder.
The mechanisms that cause laminitis are currently unknown. However, there are many sources from which this disease can originate. These include digestive complications attributed to excessive grain consumption, sudden intake of large amounts of lush grass, a high fever, and excessive wear and tear on the hooves. Any type of vascular change in the foot can disrupt the flow of blood, which may lead to laminitis. Another huge predisposition to the disease is obesity. Laminitis can occur very suddenly, and the acute symptoms include lameness in the feet, hot hooves, increased digital pulse in the foot, pain in response to hoof testers, especially within the toe region, and a hesitant gait when walking. It will seem as if the horse's feet are in pain, and the horse may shift his weight often and lean back on his legs in order to alleviate the pressure of his front hooves. Chronic laminitis, on the other hand, is an ongoing problem. These signs include hooves with many rings around them. Their soles will have dropped and contain several bruises because they are so tender. The white line around the hoof will become increasingly wider, and the hoof will form a dish shape. This is due to the fact that the heel grows faster than the toe. If left untreated, the hoof will eventually form a U-shape. The prevalence of laminitis is broad in range and depends on the horse's breed, geographical location, access to fresh grains, quality of farrier care, and discipline. Any type of statistic is highly dependent on what type of study is being conducted. Often, the majority of laminitis cases are ponies. One important thing to remember is that every horse is susceptible to the disease. Treatment of laminitis is ultimately dependent on the degree of vascular and laminar damage the hoof endures, as well as the duration of time the disease has had to deteriorate the hoof. The best way to choose a treatment plan is to assess the methods available and compare the effectiveness with the cost, as well as the prognosis. In regards to treatment, there is no definitive cure, but there are great management options. Horses that are being overfed will need dietary restrictions on grain-based feeds. They will only be able to eat hay. Preventative measures to make sure the laminitis does not come back include keeping the horse on a low-grain diet. If the horse has an especially poor diet, they will need to have their GI tract purged through nasogastric tubes with mineral oil. To meet any dehydration needs, the horse can receive IV fluids. If the veterinarian discovers that there is an infection within the hoof, they can administer the proper antibiotics. To alleviate pain, anti-inflammatory NSAID drugs may be administered as well. Overall, proper shoeing may be extremely beneficial in this situation because this can help evenly distribute the horse's weight and take pressure off of the sore foot. Along with proper shoeing, regular farrier visits will ensure that the horse's weight is being evenly distributed on all 4 feet. Why is laminitis so devastating?
Horses develop laminitis, of course. This damages their feet to the point that they're unable to move around. They can no longer experience the satisfaction that they get from staying in herds or together with other horses. They lose this. So aside from the pain that they experience in their feet and the suffering, there's also a mental part to this to the horse, because losing their ability to flee or run has a great effect on their emotional stability. The real key to laminitis is to prevent it, because the disease does so much damage to the horse's foot, they can never be the same.
As you can see, the horse in this clip is exhibiting clear signs of laminitis. Early diagnosis is key so that symptoms never become this severe. This immediate detection is best found by the use of new equine veterinary technology in the form of magnetic resonance imaging. This technique uses modern medicine that utilizes nuclear magnetic resonance in order to look at details of internal structures. It is helpful in evaluating and creating three-dimensional images of osseous and soft tissue structures. It accomplishes this by evaluating the horse's limbs on a magnet. This magnet will align the atomic nuclei in the body and allow them to produce a magnetic rotating field. Different settings are used depending on the study design. In the following video, an expert explains the intricacies of the MRI process.
MRI is a relatively new diagnostic modality used in horses. When we look at it in comparison to the human field, MRI is considered to be the gold standard for diagnosing injuries in the human athlete. And the whole goal with MRI is, number one, to get a more accurate diagnosis, but number two, to be able to identify what the problem is and then more accurately treat it to improve the horse's long-term athletic soundness. When we compare MRI to radiographs and ultrasound, radiographs only look at the bone. So it has been estimated by radiologists that a 40% change in bone density is required before the human eye can detect any change on radiographs. And that's a pretty startling change. When we look at MRI in contrast, bone bruising where there's fluid increase in the bone or a crack in the bone, fluid will accumulate within the bone. That will show up very readily on an MRI and not be present on radiographs. I think when horse owners are trying to decide when do I do an MRI, I think there's a lot of different scenarios. One is maybe an acutely or sudden onset lameness that we can't find a clear answer and we need an answer soon because the horse is going to a competition. Another situation may be a case where the horse, we feel we have an accurate diagnosis, we treat the horse, it hasn't responded like we would expect them to. The real advantage of the standing MRI for us has been the fact that we can do a lot of our MRI imaging standing. It's much safer for the horse. The horse can come in, just be sedated, and it does sometimes take a little longer just for the horse to initially adjust to the room, but then once the horse is adjusted, they typically stand there quite well. We are typically generating between 600 and 1,000 images when we MRI a horse, and the typical MRI with the standing horse is between an hour and a half and 2 hours. In the United States, when we look at the standing MRI systems, there's either 13 or 15 throughout the United States. We've had ours here for 5 years. The closest standing MRI to us would be in Ohio.
Economically, MRIs are impractical because there are only a few facilities that have operating machines. Therefore, the travel expenses to bring the horses to these facilities must be a financial burden. Additionally, the MRI itself costs upwards of $2,600, not to mention the additional cost of the anesthetics. Those prices will depend on the horse. MRIs can be extremely ethical to use because they are non-invasive and the process is not overly traumatic. They are safe for the horse because they do not give off radiation. A standing MRI can scan specific pieces of the lower leg, including the feet, pastern, and fetlock, using a low-field magnet. Scan only requires the horse to stand for about 2 hours in order to generate the proper number of images. Alternatively, the lying down MRI can scan from the knee down using a high-field magnet. This horse will require full anesthesia to keep them perfectly still and lying flat. This is dangerous to the horse's well-being because there can be several complications. The horse may have a poor reaction and the medication is costly. The report is complete within 48 hours of the scan, no matter what type of MRI is used. This includes a full diagnosis with treatment options. Overall, the image quality is outstanding and can lead to acute diagnostics in which the reader can see tendons, tissues, and cartilage.
To the room, passing out $100 bills, and it kills and it thrills like the horns on my Silverado grill. And I buy the bar a double round of Crown, and everybody's getting down in this town. Ain't never gonna be the same, 'cause I saddle up my horse